Everybody from the government to large employers are getting in the business of quality measurement. But what does one of the major commercial enterprises involved in HealthGrades think of this movement? Welcome to the Clinicians Roundtable on ReachMD XM Channel 157, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter for the Chicago Tribune, and with me today is Dr. Samantha Collier. She's the Chief Medical Officer of HealthGrades, one of the nation's largest independent healthcare ratings companies. HealthGrades provides ratings and profiles of hospitals, nursing homes, physicians, and even prescription drugs in an effort to help millions of consumers with their healthcare choices. HealthGrades provides comparative quality outcomes on almost 5,000 hospitals and receives about 50 million annual page views. Dr. Collier has been HealthGrades Vice President of Medical Affairs since 2002, and in addition, she works as a hospitalist at Kindred Hospital in Denver, providing weekend coverage for the critical care team, requiring intensive care management of 15 to 20 patients in a long-term acute care center. And Dr. Collier joins us from HealthGrades offices in Denver, Colorado. Dr. Collier, welcome to ReachMD.
Thank you.
Well, it's a pleasure to have you here because HealthGrades is one of the companies that has been at the forefront, really, of the effort to provide quality information to consumers. And if you could, give us a little background on HealthGrades and what is going on with the company and how does it work?
HealthGrades is the leading independent ratings company in America. We rate every hospital in the United States on about 27 to 31, depending on what state you're in, different conditions, everything from bypass surgery to knee replacement, stroke care, pneumonia care. And we make this information available for free at healthgrades.com. We're getting ready to go into our 11th year of these types of ratings. And we do this because our compelling reason for being in business is to help guide America to better health care.
Well, so tell me about this growth. That is interesting. 11 years. I mean, it just seems like, I've been at the Tribune for 10 years. I've been writing about the business of healthcare for almost 20 now. And it just seems like this is still in its infancy. But when I read your intro and I talk about 50 million page views a year, I mean, that is quite a lot. Could you tell us, our listeners, a little bit about the growth and how this all started and kind of, where you have gone, either in terms of page views or just in your ability to draw consumers to the site?
Well, I think it's multifactorial, what has contributed to our growth. I think first and foremost, probably the most important one for the listeners is that more and more people are getting high-deductible health plans, right? HRAs, HSAs, or plans that they don't have to pay as much to their employer to be part of. They take a little bit more risk with regard to the finances. So, for example, I have an HRA through HealthGrades, and I have to spend roughly $2,000 before any of my insurance kicks in. That $2,000 is substantial enough for me to do my homework. Now, I'm a physician, so I definitely know a little bit more than the typical consumer, but I think some of the growth that we've seen as far as our page views and unique visitors to our site is a result of what we're calling consumerism. More and more patients or consumers are getting more of that health care premium shifted to them from their employer, and so they're more incentivized to make better choices. I think the second is media, shows like yours, as well as, everything from CNN, ABC, local affiliates, newspapers, print, journalism, everything. There's been just numerous stories on medical errors, and that quality is really, very different from place to place. And even celebrity talks about, what has happened with their family members in the hospital, whatever it might be. So there's been a lot of media attention and focus on it, which has also, I think, helped elevate the cause for quality. And then thirdly, one of HealthGrades' core competencies is what we call search engine optimization. So we have worked extremely hard over the years to match consumers to what they're looking for. So if they're doing quality in Denver, we want to make sure that they find some way to get to HealthGrades.com. And so our partnership with Google Health it should just take us to the next level on that.
Well, tell us who, for the medical professionals listening or anyone out there, who is the typical person or patient that is going to HealthGrades? Or is there a certain person or a group of people, or is it really everybody these days?
Well, I mean, I think in general, everybody is starting to check out differences. You know, healthcare is really one of the top searches on the internet, of which most begin via the top search engine, which is Google, and they get to our site through a lot of the different search engines. But the most common demographic of HealthGrades information is, you know, probably not surprising, right? It's the 40-year-old mom who's trying to take care of her family, who's educated, whose family's relatively educated, who's insured, and she's trying to be proactive about her family's health care needs. So that's the typical demographic that's using our information.
Well, if you're just joining us, or even if you're new to our channel, you're listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter for the Chicago Tribune, and joining me today is Dr. Samantha Collier. She's the Chief Medical Officer of HealthGrades, which is one of the nation's largest independent healthcare ratings companies, and HealthGrades is based in Denver, Colorado, and she joins us from Denver today. And we're talking about HealthGrades and how it all started and what the explosion of information out there that basically needs a conduit to go to. Now, even with the Google Healths and other efforts going on out there to be a clearinghouse, if you will, is HealthGrades still seeing a lot of growth, and do you have a certain return customer, and also how has this evolved? Because I think you started with hospitals, but HealthGrades has evolved into much more.
Yes, we started in 1999. HealthGrades started, and like I had mentioned earlier, you know, we're going to be going into our 11th rating season. Every year we update our ratings on hospitals. We do that once a year in October. But we also have so much more information. We, over the years, have added probably the most comprehensive physician database that includes about 650,000 plus physicians in the United States, and has robust information about where they went to medical school, where they trained for residency or fellowship, where they currently practice, whether they're board certified, and if so, in what specialties, and if they have any disciplinary and in some states even malpractice information. And so, you know, we encourage all physicians to Google themselves, find out what's out there, make sure the information's accurate, because the data we get is not perfect. We do our best to verify these sources of information because we want to make sure patients get the right information, but also that we're displaying the information correctly for physicians. We also have cost reports where, again, someone like me who needs to spend $2,000 before my insurance kicks in, I might want to do some shopping around to see if I can get the best price on an elective procedure, and I can start again at healthgrades.com and get some information about just generally what is the price of something that, or what should I expect to cost, and how can I plan for that maybe in my flexible spending account or whatever it might be. We also have information on every nursing home in the United States, and I think with the baby boomers going to be, you know, one of the largest parts of our American population, and that, you know, care is not the same from not only hospital to hospital, but nursing home to nursing home. We really, you know, need to check that out, where we're going to put our parents and our loved ones. And then we recently just released a drug ratings tool so that patients can see if they're getting maybe the most effective treatment and how that stacks up with what other patients thought. So as far as our growth, you know, again, if you think about our compelling reason to be in business is to guide America to better health care. A lot of that is not just through acquiring information, but acquiring information and then putting it out there in a way that's actionable, in a way that allows consumers/patients to make good decisions, and making that information accessible, transparent, and easily understood.
Well, you bring up an excellent point when you talk about the information that's actually already out there, because I know a lot of physicians that may be listening, patients might drive them a little crazy because they're ripping stuff off the internet and they're coming into the doctor's office and saying, what about this and what about that and whatever. So really, when HealthGrades gets its information, a lot of the stuff that you're probably getting are from public databases, and a lot of doctors might not even know it's there. It could be from a Department of Regulation where it would show that the physician's license is in good standing, or if you're talking about a Medicare cost report or something, and you know what charges are. And so I think when physicians and other providers get this information, they're thinking, where in the world did they get this? But what you're telling us is that with HealthGrades, it's usually information that's there, maybe on a state website, but it's packaged in such a way that it probably makes more sense.
That's exactly right. I mean, I think where some of the big research is coming out is how do consumers use information specific to healthcare to make decisions, right? Information is just that. Information, sometimes it's not even relevant. I think what really differentiates HealthGrades is, again, through being kind of the leader in search. We're getting consumers and patients who are looking for very specific things, right? Where's the best place to get my knee replaced? Who's the best physician to do that? Are they board certified? And so, we're giving them information at, so to speak, the point of decision making or point of service. These are patients who are ready to take that next step. These are not patients who are just randomly looking up what is diabetes or, what is a stroke. These are patients who know they either have diabetes, have stroke, have risk for one of those, and they're looking to get the best treatment. Where do I need to go? And so, that's really the challenge in medicine, but also the internet age is there's so much information. The information that HealthGrades has, none of this is proprietary. As you mentioned, this is all publicly available information that we package in a way that's actionable, usable, but more importantly can be located in one place through an easy search engine. Right now, if I wanted to know whether a doctor was board certified, without HealthGrades, I would have to contact the state medical board. But then I may have to go to another site to find out if they had malpractice, and I'd have to go to another site to find out how many they did, and I'd have to go to another site to find out how the hospital did. And so, as you can see, then that becomes quite cumbersome. Most of us don't have the patience for that, especially when we're used to clicking on the first or second link on a search page. And again, that's what I think physicians maybe don't understand, is that the information that everybody has on them right now, which isn't just HealthGrades, there's all kinds of organizations that have this information. It is already publicly available. Everyone's just trying to make it more usable.
Well, I'd like to thank Dr. Samantha Collier, who's been our guest. We've been talking about her company, HealthGrades, which has healthgrades.com. They're providing more and more information every day for the U.S. consumer that physicians should be aware of, that their patients will be coming in their offices with more credible information and even more information than ever before. I'm Bruce Japsen of the Chicago Tribune. I've been your host, and you've been listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. To listen to our on-demand library, visit us at reachmd.com, register with promo code RADIO, and receive 6 months free streaming for your home or office. If you have comments or suggestions, call us at 888 MD-XM 157. And I'd like to thank you today for listening.
Hi, this is Dr. Clarissa Gracia, Assistant Professor of Obstetrics and Gynecology at University of Pennsylvania. You're listening to ReachMD XM 157, the channel for medical professionals.